name's Stephen Maletic and I'm currently a third year Bachelor of Nursing student at the Swinburne University at the Wantirna campus. I'm currently applying for the Epworth Hospital Geelong Graduate Nursing Program in 2020. This will be in the perioperative stream. Some notable values that resonate with me about the Epworth Hospital are a supportive and dynamic environment, as well as transitioning to high levels of independence, and noted that they strive for excellence in clinical practice. The hospital's graduate program facilitates in this transition to becoming a confident and competent registered nurse. Additionally, through watching online videos of graduates on the Epworth website, I believe that the Epworth Hospital are one of the leaders in healthcare. They offer a huge range of specialty areas that you can be rotated in during a grad year. And they also offer areas of interest to meet the needs of the graduate, and they offer a structured and challenging clinical learning environment which I feel allows for an opportunity to develop a sense of belonging through shared values and collaboration by working as a team. This helps the individuals progress to where they want to achieve their goals, and I also noted that most graduates stay on after their graduate year. This to me reflects the professionalism and supportive environment of the Epworth Hospital. So why should you employ me? Whilst I'm currently studying my Bachelor of Nursing, I'm working full-time as a painter and decorator. This is a local-based company in Geelong. I've been at the company for 12 years now, and my role within the company is as a team leader. This is where I supervise as many as 4 other employees who work directly under me. The role as team leader, I believe, has given me the ability to direct and instruct other team members. These management skills include working on sites with multiple professions and also with the management team, as well as liaising with each profession to ensure time frames are met and all staff are working in a cooperative and safe manner. While I'm not currently working as a nurse, I feel as though I apply and relate to the values of the Epworth Hospital. So during my time at Swinburne University, I've had many placements. However, the 2 placements I had at Epworth in Richmond, I felt were the most enjoyable and memorable. These placements were in an acute setting and in the orthopaedic ward. This experience took place for a combined total of 7 weeks, and this has given me a greater understanding of what is expected of nurses at Epworth Hospital. I have an enormous appreciation for the professionalism and hard work of the nursing staff, to which I aspire to be. The skills and tasks that I learned along the way while working under my buddy nurses was managing a patient load, liaising with other health professionals. This included surgeons, pharmacists and physiotherapists. I was also able to complete bedside handovers and progress notes. I was able to recognise all procedures that had been taking place in the theatre, and this was due to looking at hospital care plans which allowed me to care for post-operative patients. I always felt the support of the staff, and they would always provide feedback at the conclusion of a shift. This gave me greater confidence in my abilities every day. I was also given the opportunity to be part of the patient's discharge. This allowed me to be actively involved with the patient's care and to ensure they had everything they required upon discharge. This was also an opportunity for them to express any concerns that they may have had. During this time, I had the opportunity to work with many acutely unwell patients. This is when I came to the realisation that this would be the area that I would be best suited to. This is why I've chosen perioperative and the Epworth Hospital to be my specialty placement at the end of the year. So what are some of my unique qualities? I believe I possess many unique qualities. Firstly, I feel I'm passionate both about nursing and healthcare, as I'm currently in my 3rd year and have thoroughly enjoyed all my units of study at Swinburne and have thrived in all my clinical placements to date. I feel as though I'm team orientated. As mentioned before, coming from a trade background has allowed me to be an integral part of a team dynamic. This has also allowed me to grow and develop leadership skills during this time. Additionally, this has enabled me to work under pressure due to strict deadlines and ensuring timeframes are always met. I find I've also well developed time management. This is mainly due to working and studying both at a full-time capacity. Sometimes trying to find a balance can be difficult. However, I've always made it work to the best of my ability. My passion and determination has given me the drive to ensure I see through all of my studies. Finally, I believe I've shown a great deal of loyalty to the company I've worked at for the past 12 years. These are only a few qualities I possess in which I intend to build on as I enter my nursing career. So what are some of the challenges that I think that I might face in my graduate nursing year? A challenge that I may face in my graduate year is that I currently work in a trade background, and I've only ever worked in a trade background. A lot of my nursing experience has come from clinical placements. I think that lack of nursing experience and trying to adapt to a completely different environment may be challenging to begin with. Another challenge I feel I may face in my graduate year would be transitioning from student to registered nurse. To me, this will be an unknown, as I feel I would not quite know my place within a new workplace. As well as trying to find my feet may be difficult. Although I know I would be fully supported, the initial stages may be a little tough. Finally, the confidence to be able to work independently. This can be achieved by gaining confidence through feedback and encouragement from fellow staff members. What are the future goals that I aspire to within the next 5 years? As I plan to work in perioperative, I would like to further develop my studies by completing a graduate diploma of perioperative nursing. I'd like to undertake this at the completion of my graduate year. This will be to build on my competencies and consolidate knowledge. Additionally, I'd like to continue throughout my graduate year is one of the e-learning packages. This will enable me to build on my capabilities as well as my self-development. Finally, I would like to progress and work my way up the nursing ranks, possibly into a management role. I feel as though I have already established some leadership qualities due to my current workplace. I hope this has given you an insight into who I am and what I can bring to the Epworth Hospital. I look forward to hearing from you.